May I know your name and age?
Yeah, my name is Kumar. I'm 21.
Okay. Do you have any stomach pain or indigestion or any stomach related problem?
No, I don't have any stomach related problems, but I would like to have a general checkup.
First, inspect the stomach on the exterior side and check whether there is an asymmetry or scars or striae. And then ascalate on the four quadrants of the stomach. Listen for the bowel movements. Slightly percuss on the abdomen to access the tympani and dullness. Tympani means it's a musical sound which is highly pitched. We can hear it when there is a gaseous obstruction. At first, slightly palpate on the abdominal wall. And then deeply palpate. Make sure you are covering only four quadrants of the abdomen. This is the mid-clavicular line. Percuss on the towards the border of the liver. And identify whether there is a dullness present at the liver. Then place your left hand below the thorax of 11th and 12th ribs and protrude your fingers at the quadrant towards upside of the liver to ascalate the liver. Okay, take deep breath. Then protrude the fingers at the border of the quadrant in and out. Place left hand below the thorax and gently strike on the rib cage. Palpate to find the edge of the spleen and then percuss on the anterior axillary line to find tympani on dullness. Place one hand below the 12th rib and one hand anteriorly below the costal margins and try to palpate the kidneys. If the patient is thin, we can easily palpate kidneys. But here our patient is thick, so it's very difficult to palpate for kidneys. Examine the abdominal aorta slightly left to the midline. Check the abdominal aneurysm by pressing slightly on each side of the abdominal aorta. Start. Put the patient in sitting position and access the costovertebral angle tenderness. By using the ulnar side of your left hand, do access. Abdomen is protuberant with normal bowel sounds and abdomen is symmetrical in position, no masses are found, and I can find edge of the liver, and it's very difficult to find the kidneys. as the patient is thick and because his abdomen composed of more quantity of adipose tissue.